Hey guys, thank you so much for joining me today on this episode of Tracy's Tuesday Talks. I have a very special guest whom I hold in high regard, Jim Patton with Horizon Planning Group. And today we are going to be talking about Medicare 101. So Jim, take it away, introduce yourself.
Boy, you have raised the bar with that holding high regard comment. So, yeah, well, like you said, I'm Jim Patton. I retired from the Army and corporate. Well, I wouldn't say I retired from corporate America. I got liberated from corporate America, and have been on my own for about 22 years now. And I'm now a financial planner with Horizon Planning Group. And as an adjunct to that, I've got another little sub-company that I run called Patton Health and Wealth, where I run my Medicare business out of. So I find the two mesh very well together because they are all one part of each one of a part of the whole person. So.
Oh man. And Medicare, there is so much emotion when people hear the word Medicare. Some people feel relief, some people feel angst. So let's dive in. And Jim, what is Medicare?
Well, and let me just say something about what you said. I think the biggest thing that people feel is confusion. I was talking to a guy I was talking to, because what is Medicare? Medicare is a huge government program. And as all government programs go, it is layered with bureaucracy. So in its purest form, Medicare is a program that was designed to help provide for the medical insurance need for folks who were moving into retirement. Mm-hmm. It's, like I said, it's a huge government program. It's managed by a organization called and I got to use my cheat sheet here, Centers for Medicare and Medicaid Services, always referred to as CMS. So once you go on Medicare, CMS becomes one of your friends.
Oh man, government agency as a friend. That's the first time I've ever heard that, and it's worked out well.
Well, yeah. What were the four great lies? I'll respect you in the morning. I'm from the federal government and I'm here to help you. And I can't remember the other two.
So Jim, what are some of the benefits of Medicare?
Well, one of the biggest benefits of Medicare is actually, even though we all kind of kid around about it, for folks who are in retirement, takes a lot of the financial burden out of planning for their health care, because the government does do a really nice job with Medicare of providing for the basics. Now, there's a lot that we'll go into as we go through this conversation where there's still a lot left uncovered, and I think that's one of the things that a lot of people miss is what Medicare covers and what they don't cover.
Yeah.
Is it like I was working with a guy last night? He has. Well, let me back up a little bit. Maybe we should talk about the four parts of Medicare first.
Let's do that. Yes.
Because this whole story will make much more sense if you understand this. So, the basic parts of Medicare are what we always hear of as Medicare Part A. And Medicare Part A covers hospitalization, hospice, home health and skilled nursing facilities, limited coverage of skilled nursing facilities. Don't confuse Medicare Part A with long-term care. Generally what it covers is if you go into a lot of folks who go have a cert, and I think almost everybody knows somebody like this, goes in for a surgery or gets sick, goes out and goes to a skilled nursing facility for rehab. That's what Medicare Part A pays for.
Gotcha. So it'll cover like rehab after surgery, but it won't cover a nursing home.
As not in a long-term care situation. Exactly right. And I think that's something that people get confused with too. They say, oh, it covers skilled nursing facility. And then they get a rude awakening when they've got to put mom or dad into the nursing home with dementia.
Yeah. Mm.
So, and it's a whole separate conversation that would be where Medicaid might pick up,
Mm.
which is a whole different bureaucracy. Yeah. So that's Part A. And you automatically get enrolled in Part A when either you turn 65 or you've been on disability for 24 months.
So when you say automatically, somebody who turns 65, they don't have to do anything or sign any paperwork. They just automatically get enrolled into this program?
Yep. One day their card shows up. My bias, because there is also a kind of an enrollment window for that's like 3 months before their 65th birthday and 3 months after their 65th birthday. You're counting on the government to do what it's supposed to do. You can just you can go on to Medicare.gov and enroll yourself during that initial enrollment period. And it is actually very easy to do. I did that when I turned 65 and it was no big deal.
So the enrollment period is just in case the government, oops, I missed somebody.
Yeah.
Gotcha.
Yeah. So that's Medicare Part B or Part A. Part B covers for, and there is no premium associated with Medicare Part A. So Medicare Part B covers, and I just listen to what they cover and think about. I'm running into a lot of people who think they can do without Part B. So that covers physicians, outpatient services, preventive services, occupational and physical therapies, home health, more skilled nursing facilities, and certain infusion drugs. So look at all of the stuff that if you are not enrolled in Part B, you're paying for that. Unless you've got some form of private insurance, we'll talk about that later. Now, whereas enrollment Part A is automatic, and this is where the self-enrollment becomes critical. Most folks are going to want to enroll in Part B concurrently with enrolling in Part A. And that's where you need to go into Medicare.gov to enroll and just do A and B, boom, done. The exception to that might be, and boy, there's getting to be more and more of these people who are continuing to work past age 65, and they're going to be covered by their own company health care. Because, and this is where it gets a little sticky, and I might as well just talk about this now. If you miss the initial enrollment period for Part B, that 3 months before, 3 months after, and it was like this guy I was talking, and that's where I was going to with this story. The guy I was talking to last night, his Part A card showed up. He never has enrolled in Part B. He's now 66, and he's never enrolled in Part B. There is also a enrollment. There is a penalty because Part B, you pay a premium.
Okay.
And it's a graded premium depending upon your income. Goes, well, let me just give the basic premium because that's what most of us would do, is about $170 a month.
Which isn't terrible compared
to. Which isn't terrible. But, you look at, for 2022, you might remember everybody was getting all excited about a 5.6% increase in Social Security. The Medicare Part B premium went up just about enough to make up for the increase in Social Security.
So that's another question that I've got then. So does the premiums from Medicare automatically pull from Social Security, or are they two completely separate programs?
Great question. The answer is yes. So if you are if you have filed and are drawing Social Security, it gets deducted from your Social Security check.
Okay.
If you're not, CMS sends you a bill every quarter and you
Gotcha.
write a check
Gotcha.
for the 3 months of Medicare Part B premium.
Gotcha.
So that's Part B. So again, look at all of the stuff it covers. Now, the other piece about Part B that folks need to keep in mind is that there is a deductible. Let me find what that is, $233. And there is and it is what we call an 80-20 plan. That is, once you meet the deductible, Part B pays for 80% of everything that you have, and you pay the other 20%.
So once again, it doesn't cover everything.
No, and there's no cap on that.
Good.
So let's say you go into a hospital or what have you, and you incur, just to make the math easy, $100,000 worth of Part B expenses, which is not hard to do these days.
Right.
Medicare would pay $80,000. You'd be on the hook for $20,000. That's where Medicare supplements come in, and we'll talk about them, as a separate conversation, I would suggest. So that's Part B. Part C is what's known as a Medicare Advantage plan, and that's we'll kind of cover this up, and then we'll come back and talk about them separately because they are their own animal. These are what you hear Joe Namath and Jimmy Walker shouting at you about on TV endlessly. But yeah, we'll talk about them because they have their own unique characteristics. And then the other official part of Medicare is Medicare Part D, which is a prescription drug plan.
Gotcha.
And it is also a separate enrollment. And in fact, generally, I can't think of any other exceptions to this. Medicare Part D is run by commercial insurance carriers.
Okay.
So you actually buy your Part D plan through a Humana or United Healthcare or Anthem or any one of them.
Interesting. Okay.
The other piece about Part D, and it has a premium associated with it, which is different for every carrier. To be eligible to do that, you've got to be enrolled in Part A and entitled to Part B, which is basically means you're 65. You don't need to be enrolled in Part B to enroll in Part D. Have I confused everybody totally now?
I think you're making a difficult, confusing topic a little bit more clear. So let's just recap real quick. So
go for it, Tracy.
Part A, remind me again what Part A is for.
Part A is basically hospital.
Okay, so
it's a little oversimplification, but that's basically what it covers.
Part A, hospital covered.
Yep.
Gotcha. No premium.
No premium.
Automatically enrolled when you turn 65.
Yep.
Part B would be things like infusions, some long-term care, and what else am I missing with the Part B?
Basically anything your doctor charge you for.
Gotcha. So doctor's visits, preemptive care, all that good stuff.
Going to see a specialist.
Gotcha. So that one you do have to enroll for. There is a premium, and it covers 80% of the costs once you've hit your deductible.
You're correct.
Awesome. And then Part C, Medicare Advantage, we'll dig into that.
Yeah, we'll loop back around to those.
Perfect. And then Part D is for drugs.
Yep.
Pharmaceutical drugs, y'all, not the other kind.
Not recreational.
And Part D for your medications.
Yep.
You automatically qualify, or you have to enroll with that. There's a premium with that. You have to be enrolled in Part A for your hospitalizations.
Yep.
But you don't have to be enrolled in Part B.
You got it. You just got to be entitled to Part B, which is basically anybody who's 65.
Gotcha. Okay, that's about as clear as mud can get.
Okay, cool. Now, the other thing about Part D is just like there is a late enrollment penalty for Part B, there is also a late enrollment penalty for Part D. So if you don't enroll in it when you're initially eligible, let me give you an example. I was working with a guy a couple of months ago who's 74, had Part A and Part B covered, had never enrolled for a prescription drug plan. So he had like 4 or 5 medications that he was paying totally out of pocket for. So as we looked at perhaps getting, enrolling him in a Part D plan, when we calculated the premium, his premium was going to be something like $34 a month, and his late enrollment penalty was going to be like $39 a month. So that because it's the premium, and I don't remember exactly what it is for Part B, but for Part D, it's 1% of the premium per month for every month you could have enrolled but didn't forever.
So what you're saying is if Medicare is something that you might even consider having the way to go for health insurance, on your 65th birthday, your present to yourself is enrolling in this stuff.
You are exactly correct, Tracy.
Oh, wow. So
well, we're on the let's talk about, let's kind of wrap up the Part D coverage now while we're on it, because it's a little more complicated. So with Part D, there's three phases to it, actually 4 phases. There's a phase where you're paying a deductible. And again, different plans are going to assign different deductibles. They're all generally about the same, but not exactly the same. Then you go into what's called the initial coverage stage. And this is once you get past your deductible, then you get to pay some predetermined copays or coinsurance. Now, this is where you start to get into what the drug business calls formularies. And each carrier has they've got some basic guidelines, but then each carrier is able to create its own formulary for drugs. And what that basically does is it assigns drugs into tiers. So for instance, most of them have 5, some have 6. So for most plans, tier 1 is what they call preferred generic. And a lot of times that'll be like a 0 copay or maybe a $2 or $3 copay, really cheap. Tier 2 is generic. And then you're paying a little higher copay, maybe a $5 copay, maybe a $10 copay. Tier C, and I forget exactly, and they all call these now a little bit different. You're starting to get into name brand drugs. And the bottom line is when you go up from 3 to 4 to 5, the copays get significantly more. So you got to watch, and that's something you got to look at different plans because they'll have different drugs in different tiers. Because that's when as an agent, that's the first thing we do is we go in and we literally inventory the client's prescriptions. As you can see with some folks, that can be a challenge, just getting them to round up their prescriptions and go into the plan's formulary and first determine what we think their drug costs are going to be. So you get through the initial coverage stage, and then you get to what is called the coverage gap phase. This is what is commonly called the donut hole.
I like donuts.
Yeah, you won't like this donut.
Aw.
You won't like the whole, at least. So what happens here is when you get to $4,430 of out of pocket, and that also kind of adds in some discounts too. So you get stuff that maybe you haven't seen that's counted against you here. When you hit that $4,430 things, you start to pay 25% of the drug cost, which, as you can imagine, you see these people on TV that they've got these weird drugs that it's $5,000 a month.
Yeah.
Well, let's say $4,000 a month to make the math easy. You'd be on the hook for $1,000
a month.
A month for that drug.
So what can people do to offset some of these costs?
Not a lot, frankly. That's something that to do that, they lobby their representatives to eliminate the donut hole. So then you hit, the donut hole goes through, you hit what is called the catastrophic phase. That's when your out of pocket reaches $7,050. So think you've got this time between 4,430 and 7,050, which isn't that far actually. In some of those drugs, that might be 3 months. Then you enter the catastrophic coverage phase, and you go back down to where your copays are going to be like 5% of the Medicare approved costs, or $395 or $985, depending upon what the drug is. So that's, you want to get through that as quickly as you can.
Wow.
So that's Medicare Part D. That's why it's such a crazy thing.
So how can people leverage Medicare to its full capacity and be able to keep as much of their nest egg as they can?
That's a great question. So the two things we haven't talked about yet are Medicare supplements,
okay,
and Medicare Advantage plans.
Okay.
So like I said, the first thing you got, back to the Part B, that it's an 80-20 program. That's why the government invented Medicare supplements, which are, and you'll also hear them called Medigap policies. And that is exactly what they do, is they're designed to fill the gap between what Medicare covers and what you'd be covering out of pocket.
That makes sense.
So I'm going to make that, they're simple and complicated all at the same time. There are like 8 or 10 different varieties of Medicare supplements. Each one of them is a little different. They have different coverages, different deductibles. We're not going to get down into the weeds on these right now. Talk to an agent, and they can talk you through Medicare supplements. They also obviously have different premiums. Some of them don't cover as much of the gap, and you don't pay as much. Some of them cover almost everything, and you pay a lot. And the one thing I will say about Medicare supplements, typically as you get older, the premiums go up, just because it's a risk-based product. So your risk to the insurance company grows, and your charge grows with that. So the other thing you can do is look at Medicare Advantage plans. I'm going to be flat out, I am biased here, because I personally don't see why someone would not have a Medicare Advantage plan, because it does make your life a lot easier. That's what I've got. So what a Medicare Advantage plan does, and let's go back, this is Part C, a Medicare Advantage plan, and these are all purchased through commercial carriers.
Okay.
And there's probably 87 of them out there. That's a number I just made up, but it's a lot.
90% of statistics are made up on the spot.
Yeah, that's right. So what a Medicare Advantage plan does, and it actually, combines and then replaces Medicare Part A and Part B. So if you go into, so what you do when you got a Medicare Advantage plan is you actually take your little red, white, and blue Medicare enrollment card in, and you can hide it away in a safe place. And then you get your Medicare Advantage card from your carrier and take it. And what happens then is your doctor bills the carrier instead of Medicare.
Nice.
And all of these plans are different. There's basically 3 different flavors of them. There's a couple of sub flavors, but there are ones which are HMOs, which are health maintenance organizations, which basically means, I'm going to oversimplify this. The carrier has developed a network. Some have bigger networks than others of physicians and specialists, and you're required to go to that network of physicians and specialists.
Mm-hmm.
And what'll happen is you'll have maybe a copay and a co-insurance. That'll be one rate if you go to an in-network doc. It'll be a much higher rate if you go to another network, out-of-network doc. And that'll vary. Some might not even let you go to an out-of-network doc. So that's the HMO. The second variety is a preferred provider organization, or PPO, generally a much broader range of docs, and much easier to find a doc, and also might give you a little bit of an advantage when you go, if you do a lot of traveling. There'll be a lot of regional PPOs, and you can find docs much easier when you're traveling. And then the third variety is what's and I'd hardly ever see these, called a PFFS, a private fee for service plan, which basically the docs say, yeah, we'll bill you, but we don't have to service your clients. That's our choice. Mm-hmm. That's why you hardly ever see them. But and Medicare Advantage plans, the core of them is all the same, because again, these all get pre-approvals from CMS before the carriers ever offered to or allowed to carry them, and they are required to cover everything that Part A and Part B would cover. Go ahead, Tracy.
So it sounds to me like Medicare Part C or Medicare Advantage plan works very similarly to like a health insurance plan that you would get from an employer.
Yeah, absolutely. And on top of that, well, and that also, and most of the Advantage plans, some of the variables they have within, and again, the core is the same. They're all going to cover everything that Medicare Part A and Part B covers. Mm-hmm. What's different is the premium structure. Some have a low premium, some of them have a little higher premium. I've not seen one that's got an outrageous premium. HMO premiums generally are less than PPO premiums. And they all configure the copays and co-insurances differently. So copay, think about it as a deductible.
Yeah.
So copay would be like you'd go into the doc, give them a $20 bill. That'd be your copay. Gotcha. Co-insurance would be like getting into an 80-20 situation. They also all have an out-of-pocket maximum. Mm-hmm. That's generally, I think the lowest one I've seen is like $4,000. The highest are around $7,000. Mm-hmm. So there's kind of where you're at, but a lot of times those that have higher out-of-pockets may have lower copays. So there's where you've got to kind of shop around, is to find out the combination of copays and maximum out-of-pockets and premiums that's best for you. Yeah. But wait, there's more.
There's more?
There's more.
What?
The other thing that Medicare Advantage plans do is almost all, well, I won't say all of them, but every one I'd seen has a series of extra benefits. Pretty much all of them also have vision coverage, dental coverage, and hearing coverage.
I'm sorry, what?
Huh?
Vision, dental, and hearing.
Keep your day job. Yeah. And so, yeah, vision, dental, and hearing. Some I've seen, like for dental, from $1,000 to $3,000 of benefit per year. So there's another place that they distinguish themselves. So if dental's a big deal for you, get a Medicare Advantage plan with not having to buy a separate dental plan. Also vision, they'll have different cover, because I've seen some have a $200 allowance for frames and lenses and discounts over that. Others that have like $300 for frames and lenses are included.
Nice.
Yeah. So that's where you got to do your shopping and have a good agent who knows the plans that he or she writes. And the other thing, most of the Medicare Advantage plans also have a drug plan included.
Nice.
You can buy standalone Medicare Advantage plans if you're in a situation. One of the things you cannot do is you cannot have a Medicare Advantage plan and a prescription drug plan. So Medicare won't allow that.
So it's either C or D.
Yeah. So what I do, so when I'm working with veterans a lot, we'll provide them with a Medicare Advantage plan. Or like me, I got a Medicare Advantage plan, and then I got TRICARE for Life that does my prescription drugs. I don't have a Medicare Advantage prescription drug plan. So, oh, the other thing is they've also got some extra benefits, like a lot of them will have transportation. So if you need a ride to the doc, you get a free ride, and capped at anywhere between 48 and 100 free rides a year. They also, a lot of them will provide fitness program.
Ooh, there you go.
Yeah. So where you get your and they have some different names for them, like silver sneakers. That's one of the common ones. You basically show your silver sneakers card when you go to Lifetime Fitness or LA Fitness.
I love it.
And they've got, and many of them, and here's one where they vary all over the lot, an allowance to buy over the counter stuff. So basically, like the plan I've got, I get $50 a quarter that I can go buy aspirin and ibuprofen and all kinds of other stuff. I just fill out I do it online, and just every quarter, boom, $50. And these are all individual plans. So think about this. There's no family plan in the Medicare world. So if you're looking at a Medicare Advantage plan and you're a husband and wife, you're each going to have your own plan. So looking at the dental benefits, you'd have $1,000 for one, $1,000 for the other. So that's a $2,000 combined benefit.
That's nice. That's really good. So quick question.
Yes, ma'am.
To have Medicare Part C, or these Advantage plans that you're talking about, do you have to be signed up for Part B?
Yes, great question. You do need to be enrolled in Part A and Part B.
Okay.
And there are also limits on the enrollment periods for them.
Okay.
So for someone who's turning 65, they can enroll during that initial enrollment period that we talked about before. And their plan would become effective the first of the month in which they turn 65. For most other people, they have to enroll during that annual enrollment period, which is from October 15th through December 7th. There's also, just to make it more exciting, an open enrollment plan from January 1st to March 31st, where you can kind of shift around plans.
Mhm.
There are some exceptions, like one of the things about a Medicare Advantage plan, they are approved by CMS by county. So you have to live in the service area for your plan. If you move outside of that service area, you've got to change plans.
And this is for all of Medicare or just a
Just
subset?
for Medicare Advantage.
Gotcha. Okay.
But that's an exception to the enrollment period. So if you did that, you could do that. The other common exception is if somebody has been on a company, say they're 65, 66, 67, and they've been on a company plan, and they leave that and they then retire and lose their health care from the employer, they've got 63 days to enroll in a Medicare Advantage plan and Part B.
Gotcha.
If they weren't enrolled in Part B already.
Gotcha. Whew. Well,
other than that, there's nothing to it.
So Jim, it sounds to me like you sit down with people kneecap to kneecap or computer to computer.
Absolutely. I much prefer for this kneecap to kneecap.
Yeah.
It can be done on Zoom.
Yeah.
It's much better kneecap to kneecap. And our job is to educate. Sit down, find out what's important to you, especially in the Medicare Advantage world, what's important to you, especially in terms of those extra benefits and mixing and matching the right combination of premium, maximum out of pocket, and co-pays and co-insurances.
Yeah. So basically you can sit down with people, look at their financials, look at their healthcare needs, and help them piece together a Medicare plan that's going to work best for them individually.
You got it.
Awesome. So how can people get a hold of you, Jim?
They can get me at probably the best email to use is jim@pattonhealthandwealth.com. It's a lot longer than it looks, but it's just health and wealth all run together, or 317-319-3523.
All right. Well, Jim, thank you so much for explaining Medicare, the 30,000-foot overview of it. I know I've certainly learned a lot.
Oh, cool.
All right, guys, thank you so much for watching. Feel free to reach out to Jim if you have any questions, or if you'd like somebody to walk alongside of you to help you find your Medicare needs and get you signed up for the best plan, so that way you can protect your financial legacy. And
because let me just one more word. You said something critical, because that's my role. I'm your financial navigator. You're the pilot. And the first rule in aviation is the pilot is in command of the aircraft, and what pilot says goes. I just help you chart your course.
Yes, I love that. I love that. All right, guys, thank you so much. I'll see you next week.